Stella Matutina Girls High School. The proposition for today's debate is that the Taiwan government should legalize euthanasia.
For debaters, rules for 10-minute speech are as follows. When there are 30 seconds left, you'll hear one short read. When time is up, you'll hear two short reads. When it's 30 seconds into extension, you'll hear a long read. And upon hearing that, you have to stop your speech. And rules for timing your cross-examination. When there are 30 seconds left, you'll hear one short read. When time is up, you'll hear two short reads. And upon hearing that, you have to stop your cross-examination.
Each team needs to prepare evidence cards for cross-examination. Any evidence cited during the debate should have a corresponding evidence card, which may be reviewed upon request by cross-examiner and their teammates. The cards need to be returned at the end of the constructive speech following the cross-examination.
For the audience, please turn off your cell phone or turn it to the vibrate mode. When the debate is still in progress, please do not chat or use flash when taking pictures. Thank you.
First, affirmative constructive speech, 4 minutes.
Honorable judges, worthy opponents, ladies and gentlemen. Imagine that you are in a persistent near-vegetative state, experiencing excruciating pain, unable to get out of bed, relieve bodily fluids, and bathe yourself day after day. Wouldn't you rather end your suffering? We, the affirmative, define euthanasia as a gentle and easy death or the act of bringing about death in the case of incurable and painful disease. Euthanasia can be divided into active and passive euthanasia. Active euthanasia occurs when medical professionals deliberately administer lethal injections to end a life. Passive euthanasia occurs when the treatment used to keep the patient alive is withheld by professionals at the request of the patient's wish to end their life with dignity. We, the affirmative team, observed the following harms. Harm 1. According to the Taiwan Ministry of Health and Welfare, 44,971 people suffered from cancer in the year 2012. The Taiwan Clinical Oncology Research Foundation reported that terminally ill patients who suffered from physical and psychological pain made up between 70 to 90% of terminally ill patients. Harm 2. The aging population of Taiwan is increasing year by year. According to research from the National Taiwan University, demographic studies have shown an aging population of 7% in 1993 to a level of 10.2% in 2007. Along with an acute shortage of hospital beds and nurses, a severe problem is rising. The ratio of patients to nurses have risen from 5 to 1 to 13 to 1. Harm 3. An increased pressure on the limited medical resources for terminally ill patients and failure of the status quo to alleviate or solve these problems has resulted in a greater need to look at alternative solutions. Euthanasia is one possible solution. Thank you. Mandate. The affirmative would like to adopt the Oregon system as our model to legalize euthanasia in Taiwan. First, euthanasia should only be performed on patients with terminal illness and those who request euthanasia voluntarily. Before euthanasia should be performed, 2 doctors and a psychiatrist need to be involved in the evaluation process. In addition, this case must be presented to an independent panel of medical professionals for final approval. The patient must make 2 oral requests and must not be in a state of depression. The patient must have 1 written request and wait a total of 15 days before any procedure can be authorized. Also, a psychiatrist should be called in to evaluate the patient's mental condition. Within this time frame, if the patient's mental state is lucid and stable, then the opinion of 2 doctors, including one who is an attending physician, must concur and remain in complete agreement. Once euthanasia is carried out, the doctor responsible must report the case to the government with complete details. Doctors found guilty of not reporting cases of euthanasia and not following protocol will be charged with committing murder and face legal action. Line 2, funding. Subplan. Use any remaining funds from the Ministry of Health's budget and other affiliated government bodies. We believe the Ministry of Health and Welfare has the ability to support this act. The total national healthcare fund of Taiwan, stated by statistics, stood at 425 billion NT dollars in July involved in any case of euthanasia is found to be benefited by the patient's death, he or she shall be subject to full punishment of the law. Subpoint 2. If doctor is found committing an error or has mismanagement, they shall be immediately removed from the hospital staff and face legal action. Solvency. As previously stated, the cost of palliative care in Taiwan is increasing due to the rise in number of elderly people and the increasing rate of terminal illness. Due to this crisis, the Taiwan healthcare system will be affected greatly and the cost of healthcare will rise dramatically. Therefore, our plan offers a possible option of voluntary euthanasia as a last resort. In this light, doesn't it make more sense to adopt euthanasia program, which is highly regulated as an alternative choice for the terminally ill who want to end their lives peacefully? We believe that the Ministry of Health and Welfare Trustees also support this act. Thank you. I now stand for cross-examination.
Second negative, cross-examine first affirmative. 2 minutes.
Good afternoon. Do you agree that every patient, regardless any ailment, has the possibility to recover?
Yes.
And do you think that doctors and families should give up any chance that could save a patient's life?
No, but we, as I said before, our plan provided evaluation process, so it will not be completely depending on the patient's whim. 2 doctors will have to, evaluate the patient, and their mental state is lucid and stable, then only will be move on to other evaluations. And
So you don't think that families should give up if there's a chance, right?
No.
And do you agree that euthanasia equals to giving up all chances?
no, I do not think that, because I think that euthanasia is an option for patients who don't want to continue living. Why should they continue living if they want to die? We should not force them to keep
That
continue
is
living.
something that we couldn't recover, right?
Yes,
Yes, so
but I also believe that
there are chances for patients to live because if once they're dead, they cannot come back to life. So then why choose euthanasia while there is a chance for people to live?
because I believe death is an option that people should have. Shouldn't a person have the right to decide whether he wants to die or not? It is within their rights to decide whether or not they want to continue living.
Yes, it is in a previous question that we shouldn't give up any chance. And now you've said that it is their liberty, right?
Yes.
Okay. So do you agree that patients might feel pitiful for their families who've paid a lot of time and finance for their illness?
I do not understand what you mean.
Do you agree that patients might feel pitiful for their families?
You mean that people will want to euthanize themselves because of their families?
Because of the pressure?
The pressure put on by their families?
Yes. No, not from the families, but because they feel guilty themselves.
I do not think so because not usually. Patients want to euthanize themselves because they are in pain and they are suffering. So that is
nothing there's Thank you.
First negative, constructive statement. 4 minutes.
Good afternoon. The negative would first want to clarify our position, which is remaining the status quo. In the current palliative care policy Article 7, it indicates that doctors can withdraw feeding tubes of patients, which equals passive euthanasia. So the aim today is to debate if active euthanasia should be legalized. Now, the negative will want to respond to the affirmative by the following points. First of all, the affirmative has stated that euthanasia will let patients die peacefully. However, palliative care is an alternative way since it gives patient treatments to reduce pain and improves the quality of life of patients in both physical and spiritual way. Thus, the negative would want to maintain the present state on the issue of euthanasia. According to the report by China Times on February 13, 2015, it said that the Health Insurance Department of Taiwan will increase the subsidy on palliative care starting from February 2015. The report also said that there has been a 33% increase of cancer patients who chose to have palliative care before their death from 2013 through 2014. The statistic clearly shows that more and more people agree that palliative care is a more compassionate way to die with dignity. Also, how can you assure that family members of the patient who conducted euthanasia would be peaceful and brave enough to face the truth that their loved has passed away, since euthanasia doesn't provide professional spiritual help for both patients and patient family, unlike palliative care? Dr. Tricia Brusco, chairman of the New Zealand Medical Association, said necessary pain relief treatment, even that which would shorten life, does not involve a primary intention to kill the patient. However, euthanasia does. Second, by legalizing euthanasia, it will give doctors too much power, and it's also against the oath that are made by doctors. By legalizing euthanasia, doctors would now have the rights to terminate one's life. Why should a doctor be suffering from making such tough decisions? Death is irrecoverable. If a doctor made a wrong decision, he or she would be facing big problems on medical, moral, and law problems. Also, conducting euthanasia conflicts with the Hippocratic Oath taken by doctors, which said, "I will give no deadly medicine to anyone if asked, nor suggest any such counsel." How can you assure that the doctor's decision is a moral one and not because of wanting to get rid of difficult cases to cure? Third, if euthanasia is available, the sick person may pressure themselves into asking for euthanasia. Bath and Margaret stated in his book that if euthanasia is legalized, vulnerable patients could feel obligation to accept it in order to reduce the burden on families and caretakers. Fourth, allowing euthanasia will discourage the search for new cures and may reduce the availability of palliative care. Bath and Margaret also stated in his book that another potential danger of legalizing euthanasia is the declaration of medical process for palliative and hospice. For instance, legalizing euthanasia may lessen the need for the medical profession to improve pain control. If doctors start to perform euthanasia legally, the number of patients in hospice could dramatically decrease as a result. Hospice might even get integrated into general hospital. Last but not least, legalizing euthanasia will also weaken the society's respect for the sanctity of life, and also accepting euthanasia accepts that some lives are worth less than others. If euthanasia gains acceptance in our society, it will further weaken our respect for life. Allowing a person to use death as a solution to problems sends the message to the world that our God-given life is not special, not worth living, and that the ban on killing on the innocent can be overruled to conform to human standards. If we accept it's okay to end some lives, we may regard human life less valuable and special. Thank you. And now stand for cross-examination.
First, affirmative cross-examine, first negative.
So you said that palliative care relieves pain.
Yes.
Well, are you aware that palliative care actually cannot relieve all pain, and that there are treatments in palliative care that are actually cause pain?
And the palliative care gives person medical support for them to reduce the pain. That's the meaning of it.
So you said that your family might not be brave enough to face the fact that their family members are passing away.
Yes.
But you are aware that people in palliative care are still going to die, that no matter what they do, death is still inevitable, and they still have to face their death.
Yes, but in palliative care, there will be experts telling you what the meaning of death is, and it will give you spiritual support.
And you said that doctors will have too much power.
Yes.
Well, they said, and isn't doctor's oath to be first do no harm?
Yes.
Well, if a patient is suffering very painfully, but the doctors force them to continue on living, wouldn't that be causing them harm when they want to die? Well, as I said, a doctor's oath is first do no harm, but if a patient wants to die and is suffering very painfully, wouldn't it be even more painful for them to continue living?
No, but the doctor's oath says that they'll give patient no harm, medical support that will cause no harm. But giving euthanasia is injecting chemical. Thank you.
And you said that if we allow euthanasia, people will stop looking for cures. Is that correct?
Yes.
So what you are saying is we should keep these people alive for medical research so that we can find new cure.
No, what I mean is when euthanasia is legal, because euthanasia is more cheap, people will want to go for euthanasia, but that will cause hospice systems to go down because no one will need.
Second, affirmative constructive statement. 4 minutes.
Honorable judges, ladies and gentlemen, as my worthy opponent expressed her idea about euthanasia, I do not agree with their contentions and believe that points they mentioned are simply not true, and here are the reasons why. During the cross-examination, their first speaker asked if there is a chance, if there is a possibility that the patient might live, should we give up the chance? Totally not. However, let's face the fact, there is certain situation that there is no chance. This is why those terminally ill patients are put under the palliative act care. However, when they said that palliative act care will cause them no pain, that is a total fallacy. Because in palliative act care, what they're trying to do is they give you certain drugs that will alleviate the pain, but that does not take away all pain. Also, they say that the patient will feel guilty, that the doctors will be under pressure. However, where is the statistics? This is a hypothesis, which should not be in this policy debate. They said that the numbers in the hospital will decrease, that this, the doctors will try to take this euthanasia as an easy way to get rid of their patients. However, there is no number showing things like that. And when they say that people should not be put on the euthanasia because, there might be new cure occurring. However, people are not a laboratory. They're not there for your studying. It is the people's will to decide whether their life should be ended or not. When I was a child, I witnessed firsthand the sight of terminally ill people. And that person was my uncle. He suffered from advanced heart disease. After battling a bacterial infection acquired during surgery, he was left weak and confused. He couldn't take care of himself, and there was nothing he could do. Everything enjoyable was taken away from him, and he did not want to live. Life was not worth living without autonomy, he told me. He wanted to die with dignity. But we live in Taiwan where euthanasia is not an option. How ironic that my uncle could not end his life with his own will. He suffered for another 2 years. As hard as it is to say, terminally ill people are basically waiting for death because there is no other solution for their illness, and yet they're kept there for what? In Taiwan, there are many other terminally ill patients like my uncle spending the last stage of their life suffering. Out of the 9% of the 33,000 patients who have cancer receive euthanasia, meaning that the other 91% of the patients do not receive palliative act care, meaning the 91% of the other patients, they have nothing aid from the government. And also, 24 hospitals with palliative care act awards only 60% of those patients, so that the 40% of the patients did not receive palliative care act. We stand for euthanasia. This is not to say aid in death should be left unchecked. Laws should be narrow and specific. Regulatory systems should be in place to thwart involuntary euthanasia and access for psychiatric illnesses. Practices and medications should be routinely updated to reflect new information. Yes, we do understand that no system is infallible, and there will always be unintended consequences. However, these risks alone do not warrant inaction. If they did, we would not have government, no legal system, and no help of any kind. It is not the existence of risk, but how we respond to it that determines our outcomes. By acknowledging the risks involved and letting it guide our policy making, we can better protect suffering patients and their family. Many people in the world today are against euthanasia, and their reason is simple. We should respect life. Unfortunately, there are some people who suffer from terminal illness, like Wang Xiaoming, We, the affirmative team, stands on the side of free choice. The voluntary euthanasia performed under safeguards and control as stated in our mandate of the plan. We, the affirmative team, values the equality of life more than the length of life. At the end of the day, it's up for us to decide whether we can sit back and watch people suffer or choose to improve the status quo. Until we make up our minds, the suffering will continue. I now stand for cross-examination.
First, negative cross-examine. Second, affirmative. 2 minutes.
I said you want to legalize euthanasia.
Yeah.
But after legalizing euthanasia, how can you ensure that the patients and their family would have enough knowledge to make decisions correctly?
They will discuss their decision with them. That has nothing to do with the policy. We cannot affect their decision. However, if they do make a decision, we respect their decisions and support them with euthanasia. This is another option.
Thank you, but if they don't have enough knowledge on euthanasia, how can they make sure that
Of course, before they have the decision, the doctors in the hospital will tell them what is euthanasia.
But in your speech, have you stated that you'll give them educational?
Yes, we will give them educational.
But in your speech, have you stated?
And now I stated it.
Okay. So you said that euthanasia will let people not to live in the last stage of life suffering.
Yes.
But actually, are you aware that palliative care will also have the same?
No, palliative care does not end all these sufferers. It does not solve all the problems. Palliative care is what it does is that it relieves the pain. It does not cure all the pain.
Are you aware that palliative care is a treatment of pain? It will give person reduced pain and
It reduces pain.
and
Yes.
will give people physical and psychological and spiritual support.
It does give it, but it does not solve the problems. The patient can still feel the pains, and they are still not satisfied. If it does, the cases of Wang Xiaoming will not happen.
Are you aware that Wang Xiaoming, never mind. So by legalizing euthanasia, how can you be sure that doctors will have too much power?
Because we will have regulatory laws restricting the doctors. We're not trying to give the doctors all the powers, but the doctors, instead of being the one who decides, he is the one who aids. Thank you.
Second negative constructive statement. 4 minutes.
Good afternoon, everyone. We, the negative, would like to start by questioning if the right to die is included in our basic human right. As affirmative claims, it is their liberty to end one's life. As we know, liberty is limited, and according to a due process clause, the asserted right to assistance in committing suicide is not a fundamental liberty interest protected. And as a response to the cross-examined of the affirmative one and negative one, the palliative care do support patients' mental suffering, and not just the patients, but also the families. Third, we would like to emphasize again that euthanizing people do harm the doctor's role set by the Hippocratic Oath, mentioning that the doctor will neither give a deadly drug to anybody if asked for it. Also, we would like to remind the public to be aware of the side effects that euthanasia brings. In a research in Netherlands, in a total of 649 cases, complications occur in 25% of these cases. These complications include a longer than expected time to death, failure to induce coma, induction of coma followed by awakening of the patient, or patients unable to take all the medicines. And the affirmative claim that palliative care cannot cover all this pain from the patients. But now that we have some research, what I've just mentioned shows that euthanasia does not also succeed all the time. And then as a response to the question asked in the cross-explanation, the negative would like to state that there is a risk patients may feel they are a burden on resources and are psychologically pressured into consenting. They may feel that the burden financially, emotionally, mentally on their family is overwhelming. Even if the costs of the treatment are provided by the state, there is a risk hospital personnel may have an economic incentive to encourage euthanasia consent, even if it isn't their best interest. And the patient's mental problem is should be a sure thing that should be considered. Also, we believe that euthanasia will lead to a slippery slope, legalizing murder. Many people worry that if voluntary euthanasia were to become legal, it will not be long before involuntary euthanasia would start to happen. In general form, it says that if we allow something relatively harmless today, we may start a trend that results in something currently unthinkable become accepted. And also, the affirmative claims that we don't have an evidence saying that euthanasia would inhibit the development of the palliative care, but we do. As a research in Netherlands, where euthanasia is legal, there are very few hospice facilities, very little in the way of organized hospice activity, and few specialists in palliative care. Although some efforts are now underway to try and jumpstart the hospice movement in the country, and solutions that do exist nowadays that relieve patient suffering, for example, palliative care. It might not relieve all the pains, but we will do our best to lower it down to an acceptable situation. However, it is always better than just ending one patient's life. Moreover, one more option is not always better, as it might lead patients and your families to a wrong road. Thank you.
Any second negative. 2 minutes.
Good afternoon. Are you aware that right now, at this very moment, there's 4,000 vegetative state people lying on their bed, receiving no government aiding? Are you aware of that?
Yes,
And are you aware that the Palliative Care Act does not cover that?
we do understand that
Then why, and are you
returns
aware that there's 40% of the patients, terminally ill patients, that was not put under palliative care because they're not able to afford it?
we are not, we do have a cure that if 3 patients live in the same palliative care room.
No, I'm asking, do you know that there's 40% of the patient, they cannot receive that? They didn't receive that because they don't have the money to pay for it.
Yes,
Can you tell me how much a patient should pay for Palliative Care Act?
this I'm not very clear about it.
Approximately 40,000 to 60,000. So the poor patients, they can't pay for that. You mentioned about the Netherlands statistics. When is it published?
It is published in,
So,
I'm actually,
so are you aware that right now in Netherlands, approximately only 1.4 application was passed? Not all the euthanasia was passed by the
I do
government.
know that, but what I'm talking about is that it do harm
Okay,
the development
thank you.
of palliative care.
Okay, so you think that euthanasia and palliative care, they are combined?
They're not combined.
Also, you mentioned about there will be a burden to their family and the patient. Is this a hypothesis you make, or do you have statistics to prove that statement?
This is like a fact, because in the
Yeah, but do you have statistics proving that this will happen in Taiwan? or is it a hypothesis?
Euthanasia is not already legal in Taiwan.
So is it a hypothesis that you assume it will happen?
It will happen because it do in other countries.
Do you have statistics showing that in Taiwan it will happen? Thank you.
White meaning preparation.